Have you ever looked at your own medical records and felt like you were trying to read a foreign language? Well, today we're cracking the code on all that shorthand and jargon. Okay, let's just dive right in. Take a look at this. Does this look familiar? It's a pretty typical note a doctor might jot down. Now, to another doctor or a nurse, this is a perfectly clear, super efficient summary. But to the rest of us, yeah, it can look a lot like alphabet soup. So if you've ever stared at your chart or a prescription bottle or your lab results and just felt totally lost, you're not crazy. And you are definitely not alone. It's an incredibly common feeling, and it's exactly what we are going to unpack right now. So here's our game plan. We'll start by asking, is this really a secret code? Then we'll dig into why this shorthand even exists and see just how many people are in the dark. After that, we get to the good stuff, your own abbreviation decoder. We'll also look at a list of abbreviations that are so dangerous, they've actually been banned. And we'll wrap up with the single most powerful tool you have. All right, section 1. Is this whole thing a secret medical code that's designed to keep us, the patients, from understanding what's going on? Well, the short answer is no, it's not a secret. The thing to remember is that these notes are really tools for healthcare professionals to talk to each other. Think of it like their own internal high-speed messaging system. It was never intentionally designed to confuse patients, but since we aren't the primary audience, that's often exactly what ends up happening.
Okay, so if it's not some secret plot, why does all this shorthand exist in the first place? And that brings us right into section 2.
You know, it really all boils down to two things: speed and efficiency. In a crazy busy hospital or clinic, yelling "stat" is just way faster than saying, "I need this done immediately for this patient." It's a system born out of pure necessity, with a lot of its roots in Latin, all designed to make treatment happen faster. But here's the flip side. That efficiency for doctors and nurses can create a huge communication gap with patients. And as we're about to see in section 3, this isn't just a small issue, it is a massive one. And we actually have the data to prove just how widespread this confusion is. A recent study from 2023, published by the National Institutes of Health, decided to put a number on the problem. They went out and asked regular people what some of these common acronyms really mean. And get this, the results are pretty eye-opening. Only 14% of people knew what a CBC was. Just 18% could tell you what PCP stands for. And even the term that people understood the best, ED, was only correctly identified by less than a third of the people they asked. This just goes to show you this isn't a you problem. It's a system-wide communication problem. Which brings us to the main event, section 4, your own personal abbreviation decoder. Let's start breaking down some of the most common terms you're going to see out there. Okay, in a doctor's note, if you see CO, that's just complains of. It's the main reason you came in. HX is your medical history. SOB and HTN are super common. That's shortness of breath and hypertension, or high blood pressure. RO means they want to rule out a specific condition. And A/P is the big finale, their assessment and plan for you.
Prescriptions, oh man, they have their own secret code, right? PO simply means take it by mouth. BID and TID are just Latin for twice a day and 3 times a day. QD means once daily. Now, PRN is a really important one. It means take it only as needed when you have symptoms. And QHS means take it right at bedtime.
All right, now for lab work. Remember that CBC that only 14% of people understood? Well, it stands for Complete Blood Count. It's one of the most common blood tests your doctor will ever order, and it's basically a broad snapshot of your overall health. So, what's the CBC actually measuring? It's looking at a few key things. White blood cells are your body's infection fighters. Your red blood cells, along with hemoglobin and hematocrit, all have to do with how well your body is carrying oxygen. And platelets, those are the tiny things that help your blood clot when you get a cut. Another really common one you'll see is the CMP, or Comprehensive Metabolic Panel. Think of this one as a checkup on your body's chemistry. It gives your doctor crucial info about your metabolism, your blood sugar, and how well your kidneys and liver are working. But here's the thing. Not all abbreviations are just confusing. Some are downright dangerous. And that brings us to section 5, where we look at a list of terms that are now considered too risky for medical use. In fact, some of this shorthand is so likely to cause a mistake that the Joint Commission, a major group that accredits hospitals, created an official do not use list. The whole point of it is to prevent serious, sometimes even fatal medication errors. And just look at why. A sloppily written U for unit can easily be misread as a 0 or a 4, which could lead to a 10-fold or 4-fold overdose. IU for international unit can look a lot like IV for intravenous, and mixing up MgSO4, magnesium sulfate, with MSO4, morphine sulfate, well, you can imagine how catastrophic that could be. This is why absolute clarity is so important. And all of this leads us to our final and honestly our most important section, the power of asking. This is all about the role you play in your own healthcare. Look, the goal here isn't for you to go out and memorize a medical dictionary. That's totally unrealistic. The real solution, the real key to all of this, is so much simpler and so much more powerful. And here it is. This is the single most important thing to take away from our whole conversation. It is always, always okay not to know something. You have the right, and I'd argue, the responsibility to be an active partner in your care. So the next time you see a word or an abbreviation you don't understand, just stop and ask, "I'm sorry, what does that mean?" It's the simplest question in the world, and it's your key to being safe and empowered.